Hey, if you're like a lot of people new to Medicare, or even if you've been on Medicare for a while, you've got a lot of questions. Medicare can be incredibly confusing, but I've got good news. You're in the right spot. I'm Randy Bond, Senior Benefits Advisor, and we're here to talk about how Medicare works. We're talking today about how Medicare Part B works. We're going to talk about how much it costs, what it covers, and what your options are to help save you money. Hey, welcome. Glad you're here today. Stick around and we'll enjoy this together. Hey, welcome back. Today we are talking about how Medicare Part B works. We'll talk about what Medicare Part B covers and what your costs are under that and what your options are to help offset those Medicare Part B costs. Hey, as we're getting into this, I'm Randy Bond. I'm a licensed independent Medicare agent. I don't work for any insurance company and I don't work for Medicare. We're just here to let you know how Medicare works so that you can take full advantage of that, get the most out of your Medicare benefits, and protect yourself from the costs associated with it. There's two important things to know about Original Medicare. Number one, Original Medicare was never ever designed to cover all of your costs. There's always been cost sharing from the very beginning. Number two, there is no limit on that cost share that can come your way. That's going to be an important thing as we look at Part B. So what does Part B cover? Part B is your outpatient services. So on your Medicare card, it'll say medical. But what they mean by medical is anything that is basically outpatient related. So there's a welcome to Medicare visit that's going to be covered by that. There's also your physician services. So this would be your primary care doctor, any specialist that you would see, and then any kind of outpatient hospital services. So there are some things that could take place in a hospital that are actually covered under Part B because they're considered to be an outpatient service. This would be things like outpatient surgery, where you're in and out in the same day. It could also be observation care. So even though the hospital keeps you overnight and they put a wristband on you, that is considered to be an outpatient. You're not actually admitted to the hospital, and that falls under Part B. And your ER visit would fall under Medicare Part B as well. Ambulance rides, whether that's ground or air, falls under Medicare Part B. Then things like your therapy, so physical therapy, occupational therapy, speech therapy, those fall under Part B. Mental health, outpatient services fall under Part B. Lab work and diagnostic services also falls under Part B. So if you go into the doctor, they draw some blood or they send you for an X-ray or an MRI, all of those fall under Medicare Part B. You could also expect that your durable medical equipment would fall under Medicare Part B as well. These are things like your wheelchairs and oxygen, your diabetic supplies, those kind of things would fall under there as well. There are some medications that would be covered under Part B as well. So these would be things like shots that would be given to you at the doctor's office. So any kind of biologics or things that you have to have administered to you in a clinical setting. Chemotherapy is a biggie that falls under Part B, and that's going to be important when we're talking about the cost, as you'll see here in a moment. So your outpatient services falls under Medicare Part B. So what does that cost? I'm glad you asked. Number one, Medicare Part B does have a monthly premium. So for most Americans, you don't have to pay a premium for Part A. However, for Part B, most of us get to pay a monthly premium. And for 2021, that's $148.50 per month. Now, just a word to the wise, you can kind of expect that that's going to go up. It seems like every time that you get a raise in Social Security, they're going to probably raise the Medicare Part B premium. And many of your other kind of deductibles and copays, you can see adjusted annually as well. So just want you to be aware that the costs that we're giving you are for 2021, and they may be different if you're watching this at a later time. So that $148.50 could be higher or lower. It could be higher if you're in a higher income bracket. If you make, as a single person, and this is based on 2 years ago on your tax filings, $90,000 or more per year, you get to meet IRMAA. And if you're married and filing jointly, if you're making $180,000 or more, you get to meet IRMAA as well. IRMAA is an income adjustment based on your income. So the higher your income, the more that your Medicare Part B premium could go up. And the same also applies to Part D premiums as well. So just be aware that if you've got a higher income, your Medicare Part B premium could be higher. It could also be higher if you did not sign up for Medicare Part B when you were first eligible. So word to the wise, sign up for Medicare when you're first eligible, and that is typically when you're 65. We'll link a video here so that you can see when and how to sign up for Medicare A and B. Your Medicare Part B premium could be paid for you if you're in a very low income bracket. Now, if you've been watching any amount of television and you've seen these Medicare commercials where they're saying you could get your $148 back on your Social Security check if you just call this number, let me let you know what they're really talking about and maybe help you avoid getting scammed. They're talking about a state Medicaid program. Every state has what is known as a Medicare Savings Program. This is for low income, low asset individuals. The requirements on this will vary from state to state, but typically, and this is a ballpark number, not intended to reflect what the actual requirements are in your state, about $1,500 or less per month if you are a married couple, somewhere around $1,100 or less if you are a single person. Again, check with your Department of Human Services in your state to find out the exact income and asset limits that are on those programs. But if you are in a low enough income bracket, low enough asset bracket, then you could get that $148.50 paid for you by the state, and that could be a zero monthly premium. So apart from the monthly premium, there are actually costs associated with going to the doctor. So any of those outpatient services that we mentioned are going to have costs associated with it. The first of those is the deductible. And that is an annual deductible, unlike the Part A deductible. The Part B deductible is annual, and it's a one-time deductible, meaning you're not going to pay that deductible for every single doctor or place that you go to. It's when everything adds up to the deductible, and in 2021, that deductible is $203. So that means if you go to one doctor and the doctor visit is $150, they're going to run that through Medicare, and Medicare is going to say, you haven't met your deductible yet, and the doctor is going to send you a bill for that full $150. You go over to another doctor later on in the year, they run that bill through Medicare. Medicare says they paid $150 of their deductible, they only have $53 left. That means that you're going to get a bill for $53 plus the next section that we'll talk about. So you can see that the deductible is annual and it's cumulative for all your Part B services. Now, once you've met the deductible, that's when Medicare starts kicking in their share. And that's an 80% share. So after you've met the deductible, Medicare will pay 80% of your services, you pay 20%. So 20% of the bill is going to come your way. And again, that's an unlimited amount of 20%. Now, there is a third category of billing that could possibly come your way. That's known as excess charges. There are two different types of contracts that a doctor or provider can sign with Medicare if they decide to receive Medicare. Now, over 90% of doctors in the U.S. receive Medicare, accept it. Most of those doctors have what they call a participating provider contract. That means that whatever Medicare says will pay for this service, the doctor will accept. However, some doctors, and less than 4% of the doctors in the U.S. have this kind of contract, is a non-participating contract. That means that they're not really happy with the Medicare rates. They want to get more than that. So Medicare has a rate for them that's actually a little bit lower than the assigned rate, but they're allowed to charge 15% above that. That means your cost could be higher with a non-participating doctor if you're just on original Medicare. So the way to know, does your doctor pass on excess charges or not, is just to simply ask. So a couple of questions when you're coming onto Medicare is to ask your doctor, do you accept Medicare? And do you pass on excess charges? Now, it's up to you at that point whether or not you want to stay with that doctor if they do. And again, less than 4% of the doctors in the U.S. actually do pass on excess charges, but that is one area that you would want to be aware of. Remember, though, there's no limit on the cost share that can come your way. And remember, we said something like chemotherapy could fall into Part B, or actually will fall into Part B. You need to understand that if that chemotherapy bill is $100,000, that means that 20% of that $100,000 could come your way. That's $20,000. There's no limit on how much that is. So that means that if you got some kind of specialized chemotherapy that's being administered, and it's not unheard of for that to be $1 million, that means that $200,000 could come your way. So Medicare understands that there's cost share and that cost share is unlimited. So they give you a couple of options on how to offset your cost. One is a Medicare supplement, and the other is a Medicare Advantage plan. We're going to talk about those in more detail in a later section, but you need to maybe explore one of those to help offset and protect yourself from the costs associated with being just on original Medicare. If you'd like to explore those options, we'd invite you to just give us a call. We'd be glad to give you a free, no obligation analysis of your situation and to help you see which plan might be best for your situation. We are not married to any insurance company. We're able to look and see what all the different plans in your area, which would be the right fit for your situation based on what your needs are, your comfort level, your finances, and all those kind of variables. Our bottom line is to make sure that you've got peace of mind, that you're able to enjoy your retirement years, that you're not seeing a health crisis turn into a financial crisis, and we want to help you to be able to enjoy that to the fullest. So if you'd like to get our help, just give us a call, visit us online. You'll see the link in the description down below as well, and we'd be glad to help you out. Thanks so much for watching. Stay tuned for our next episode. We're talking about Medicare Part D, prescription drug coverage. Thanks for watching.